Welcome to EJN TV. Today I'm going to explain about tuberculosis. In Kiswahili they call it kifua kikuu. I'm going to explain everything you need to know about tuberculosis. But first of all, we should know what is tuberculosis. TB. TB is a contagious infection that usually attacks your lungs. It can also spread to other parts of your body, like your brain, spine. A type of bacteria which normally causes tuberculosis is Mycobacterium tuberculosis. Although there are other bacteria which can cause tuberculosis, like Mycobacterium tuberculosis. We have Mycobacterium macroti. We have Mycobacterium bovis. There are so many bacteria which can cause tuberculosis, and Mycobacterium bovis they cause tuberculosis to animals, especially cattle. Now people ask this question: can tuberculosis be cured? In 20th century, TB was a leading cause of death in the United States. Today, most cases are cured with antibiotics, but it takes a long time. You have to take medication for at least 6 to 9 months. So the medication which are used, and these medication are antibiotics. And these antibiotics they're normally taken for a long period, for about 6 to 9 months. So tuberculosis types. A TB infection, we have what I'm going to talk about, the tuberculosis types. The tuberculosis infection does not always mean you get sick. There are two forms of this disease. The first form is called a latent TB, and another form is called the active TB. Latent TB, you have the germs in your body, but your immune system keep them from spreading. So in latent TB, you have the germs in your body, all these bacteria in your body, the Mycobacterium tuberculosis, they're in your body, but your immune system, it keeps them from spreading. You don't have any symptoms, and you don't show any symptoms, coughing, I don't know what, sweating at night, you don't have any symptoms, and you are not contagious, but the illness is still alive, and can one day become active. One day when you're exposed to those risk factors, such as for those people who are mining, HIV, and other risk factors. So if you are at a risk, if you are at a high risk of reactivating, for instance, if you have HIV people, you have an infection in the first 2 years, your stage X-ray is unusual, and the immune system is already weakened. As I said, that the immune system is already weakened. Your doctor will give you medication to prevent active TB. So that is latent TB. Another type of TB is called active TB. In active TB, the germs multiply and make you sick, and can spread the disease to others. 93% of the active cases in adults come from the latent TB infection. So the active or latent TB infection can also be drug resistance, meaning certain medication can't work against the bacteria, and which bacteria is the Mycobacterium tuberculosis. So tuberculosis signs and symptoms. Latent TB does not have any signs, as I've said. A skin or blood test can tell if you have it. Signs of active TB diseases. So if you have these signs, my friend, you must check well. First of all, a cough that lasts more than 3 weeks. Coughing. Some people are coughing blood. Chest pain, coughing up blood, feeling tiredness. Then every time you just feel tired. You sweat at night sweats, chills, trembling, fever. This fever can be caused due to interleukin 1 and interleukin 6. Loss of appetite, and the most important is weight loss. You lose weight. If you have any of these symptoms, see your doctor to get tested. Get medication help right away if you have chest pain. So tuberculosis is caused by bacteria. As I said, that tuberculosis is caused by bacteria that spread through the air. It is just a cold or flu. You can get TB only if you come into contact with people who have it. So the tuberculosis risk factor, you'll be more likely to get TB if a friend or a co-worker or family member has active TB. Also, if you live or you have traveled in areas where TB is very common, The area TB is very more common, like Russia, Africa, Eastern Europe, Asia, Latin America, and Caribbean. You are part of a group in which TB is more likely to spread or work or live with someone who is. This includes homeless people, people with HIV, people in a jail or prison, and people who have injected drugs into their veins. You work or live in hospital or nursing. Those are risk factors of tuberculosis. You work or live in hospital or nursing homes. Your healthcare work for patients at risk, at high risk of TB. You are a smoker. So the healthy immune system fight the TB bacteria, but you might not be fed of active TB disease if you have. So that those diseases, which, my friend, they degrade the immunity. HIV or AIDS, diabetes, severe kidney disease, head and neck cancer, cancer treatment by chemotherapy, medication of organ transplant, organ transplant, all the things, all this disease, they weaken the immune system. So tuberculosis transmission, when someone who has TB coughs or sneezes or talks or laughs or sings, they release tiny droplets. They release what? They release the tiny droplets that contain the germs. If you breathe in these germs, my friend, you get it. So TB isn't easy to catch. You usually have to spend a long time around someone. So there's that time of exposure. You need to spend a long time with someone who has a lot of bacteria in their lungs. You're most likely to catch it from a coworker, friend, or family members. And also, so I'm going to explain now the tuberculosis test and diagnosis. There are two most common tests for tuberculosis. The first test is skin test, and another test is called the blood test. The skin test is also known as the Mount Toxin tuberculin skin test. A technician injects a small amount of fluid into your skin at your lower arm. After 2 or 3 days, they will check for swelling in your arms. If the results are positive, you probably have TB bacteria. But you could also get a false positive. If you have gotten a tuberculosis vaccine called the Bacillus calmette Guerin BCG, the test that will say that you have TB when you really don't. The result can also be false negative, saying that you don't have TB when you really do. You have a very new infection. You might get this test more than once. And another test is the blood test. This test, also called the interferon gamma release assay, measure the response when TB proteins are mixed with a small amount of your blood. So I'm going to explain also the tuberculosis treatment. This treatment will depend with your infection. If you have a latent TB, your doctor will give you medication to kill the bacteria, so the infection does not become very active. You might get the isoniazid, rifampicin, or rifampicin, either alone or combined. You have to take drugs for about 6 to 9 months. If you see any sign of active TB, call your doctor right away. Also, a combination of medication also treat active TB. The most common are ethimbutol, isoniazids, pyrazamide, rifampicin. You will take them. You need to take this for about 2 months. Also, we have you also take them for about 6 to 12 months. Also, now we have the side effects of these drugs. The side effects, some pyrazamide side effects include lack of energy, nausea and vomiting, loss of appetite, muscle or joint pain. We have also the common rifampicin side effects. We have skin rash, upset stomach or nausea and vomiting, diarrhea, loss of appetite, and inflamed pancreas. So thank you for being with me. Thank you for listening to me. Don't forget to subscribe my channel. Don't forget to like. Don't forget to share. Don't forget to comment. Thank you.